Hello, everyone. I am going to welcome Dr. Gloria Harrison, a very dear friend of mine. And thank you so much, darling, to come here and thank you for your time.
Thank
Uh,
you
to tell
very much.
To tell quickly about Gloria, Dr. Gloria Harrison is a medical doctor with several years of experience in psychiatry before her sojourn to UK to take up a master's at King's College London in clinical and public health aspects of addiction. This was just a stepping stone and as an additional to her qualifications to her already teeming qualifications. She graduated from medical school from Abia State University, Uturu, Nigeria in May 1997. She also helped set up a mental health unit for 12 years at Federal Medical Center in Abia, Nigeria. She has written several books and co-authored a bestseller. She is a co-founder for Harrison Goodness Foundation, involved in supporting the less privileged in society in Nigeria and UK. Currently, Gloria is working as an acute adult psychiatrist in a private setup in UK. Uh, Once I had an opportunity to witness where she worked and how she worked, and she was so kind and so well behaved with her patients of various age groups and various issues. I was so touched and I was so proud, friend, looking at her being so versatile and so skillful. And I think it was one of the best opportunities I had to actually see her working. And I will quickly share how I know Gloria. So we were appearing for the SPLAB entrance exam to get our GMC license sorted to start practicing in UK. And I remember Gloria as one of the most generous people. And to be honest, she was friends with everybody in the class, everybody, and sharing her notes and being so kind to everyone. And I remember, I'm not sure whether you remember this, Gloria, but you were so proudly telling me about five of your sons and how you have come here with them and how you have raised them. And I had given you an example from a great lady in Indian mythology called Kunti, and how she is
Yes,
known for bringing up her sons all by herself and with so much of dignity. So I
yes.
always looked up to you, and you have been one of those friends I have so much respect for.
That's
So
so
thank you
kind. Thank
so much for agreeing to come over here and discuss this topic with us. So as I told you, and I shared the good news that I'm one of the finalists for Mrs. India UK
And I
2020.
hope you win as well.
Oh, thank you, darling. So we have some of the really good finalists, and there's a tough competition, I must tell you.
I know,
So
I know. I've seen the others.
thank you so much. So we are so this platform they support various causes every year, and this year they have chosen to support mental health, and which
Okay.
is a great topic. And
Yeah.
as you know that I'm working in cancer research for last few years now, and I have been supporting cancer research UK even before I entered Mrs. India UK. So it just came to my mind since we were introduced to such a good cause of mental health by Rose Maroc, and her thoughts and everything just brought to this up to me that what if I talk about mental health in cancer patients? So I combine these two causes and try to focus completely on a different group of patients and talk about it. And then I discussed with you, and we thought that this could be a good topic to speak about.
Yeah.
So a few of my friends have sent me some questions, and some of the questions I myself always wondered that what if this happens and how can we help these patients. So I have heard of a terminology called psycho-oncology, and who all are involved in this team and how it works. Can you please
Yeah.
tell us?
Okay. Um, Disclaimer first. I wouldn't say I work with cancer patients, but I've had patients who have survived cancer and have come through my unit as well. So I'm going to try as much as possible to keep it simple so everyone is able to understand what we're saying, follow a discussion, and we'll be able probably to get something out of our discussion. Psycho oncology is two words. So it's a field of interdisciplinary study and practice at the intersection of lifestyle, psychology, and oncology. So you see what we are saying? So it's an interdisciplinary between the three, your lifestyle, your psychology, and the oncology, which is the cancer path, okay? So it is concerned with those aspects of cancer that go beyond medical treatment and include lifestyle, like I said, psychological and social aspects of cancer.
Right.
The term psycho-oncology was actually founded by a gentleman, a medical doctor called Jimmy Holland in 1977 via the incorporation of a psychiatric service within the Memorial Sloan Kettering Cancer Research Unit in New York. The field has expanded since then drastically and is now universally recognized as an integral component of quality cancer care in all hospitals. Cancer centers in major academic medical centers across the country now uniformly incorporate a psycho-oncology service into their clinical care and provide infrastructure as well to support research efforts to advance the knowledge of this field. Psycho-oncology deals with the psychological reactions to the patient's experience of cancer, the behavioral component of coping with cancer, as well as the health behavior change, including preventive medicine and social factors that are associated with the diagnosis and the treatment of cancer, including the communication with the providers and loved ones and the support, the social support they require. In addition, research related to the influence of the psychosocial factors on biological disease-related processes have burgeoned over the past 2 decades. So much research has now taken biopsychosocial approach in account in managing people who develop cancer and the outcome of it. The integration of this unit into routine oncological care represents a major step towards caring for the cancer patient as a whole person.
Mm-hmm. Absolutely. I mean, that's a very good piece of information, and I'm sure not only people who work in medical field but outside medical field have also got a brief idea what is exactly this terminology is and for whom it is targeted. So that's very good. Thank you. The next question is, what is what do you think is the most important phase to support these cancer patients? Like, at what stage you think they need help, and whether it is needed at the time of diagnosis or during the period of the treatment?
Could you repeat that question again, please?
I said that I'm sure that these patients, they go through various stages of
Yeah.
mental trauma when they are diagnosed, and
Yeah.
also during the treatment phase. So can you advise that when it is being diagnosed, what kind of mental support they need from professionals or from family, and what if they go through a mental breakdown or something?
Yeah, well, you know that giving someone the bad news of you've got cancer can be one of the most heartbreaking challenges we as medical professionals have experienced in the course of our working life. It carries a whole burden of heartache, not just for the patient themselves, but also for the medical professionals taking care of these patients and the loved ones. So at every stage, pre, during, and post cancer care, it is so important to cope with the mechanisms of, the reactions that come with the news that you've got cancer. A lot of them fall into depression. You have a lot of anxiety. Some of them, develop suicidal ideations. It is the stages of grief also comes into this. And so the diagnosis and treatment of cancer is known to influence a lot of psychological well-being to a significant degree. And so the rate of psychological distress can be elevated with those who are diagnosed with cancer compared to the population norms. Common psychological reactions to cancer could be mood and anxiety related concerns, elevated rates of depression and anxiety, like I said before, in response to having cancer care. And also, we have to understand that there is also a psychological reaction to cancer, which really needs support from carers and the quality of life for that patient as well in the treatment life cycle. While the prevalence of psychological disturbance in reaction to cancer is relatively high, when compared to the population norms, many patients actually sometimes react well with extra support. And that's why we have people like you who work in cancer care research. I'm sure a lot of you are involved as well in the care and the well-being of these patients throughout the various stages of receiving the news in the first place. So to cut a long story short, at every stage, that patient needs the support of not just the society, the loved ones, but also the medical team. So we all incorporate the best care we can give to these patients during these rough patches of their lives.
Right. This is really useful, I mean, we all have learned as medical doctors that when we are breaking good news, and when we are breaking a bad news, what's the difference and how emotionally you're attached to both the things. So breaking a bad news, I remember that we have prepared and mentally ourselves and also academically to be able to do it in a flow. And it is
Yeah,
so important to break a bad news with a right kind of support for the patients and having their family around when you are actually going to break the bad news, and to for the doctors also to be using the kindest possible language and uh, showing what are the positives and how we are going to proceed. So these
yeah,
things are really important. I think it's a multifactorial but an important thing to explain to a patient. uh,
exactly.
when these patients they have chemotherapies, I have observed that a lot of them lose their hair, a lot of them lose the, in a common man's language, lose the beauty and the luster for that particular period of time, and at that time they face a lot of image issue.
Yeah.
And I really wonder that what can be done at that particular time to not have them these issues regarding their image, or even if they have those issues, how can we make them comfortable, and what can be done professionally for these patients?
Well, that's where psychology comes into play here now. And how do we help these patients to cope during that circle of going through cancer treatment? And like you said, it affects everything: their emotions, the anxiety levels, their physical appearance, the hair loss, the vomiting, thinking that they no longer fit into the society, or wondering how their loved ones view them and how the world views them as well. So coping, they are very, like I said before, there are very different stages of how people may react to the news and how, they cope with the issues that arise thereafter. A lot of people may not experience what another cancer patient experiences, depending as well on the cancer, depending on the kind of treatment they're going to receive. So if we talk about the different stages psychologically and behavioral, in the coping, the responses each person may have constitutes of what can be reflected as that person's innate coping response to a health threat. So cognitive adaptations to cancer is particularly challenging due to the multiple domains that cancer treatment affects. And so there are broad categories of coping behavior, including approach-oriented coping and avoidance-oriented coping. What I mean by that is the approach coping construes cognitive, behavioral, and the emotion facets of adjustment to cancer, including expressing the emotions, taking an active role in one's own treatment, remaining active, discussing difficulties with loved ones. Generally, research supports the idea that the use of the approach support-oriented coping can support more positive adjustments and psychological well-being than avoidance oriented coping. For the avoidance-oriented coping, it is the individual's maladaptive attempt to mitigate psychological damage from a stressful event, which is the cancer. So the emotional suppression and the avoidance of discussion related to the topic of cancer, as well as the passive behaviors, preclude individuals from directly managing the concerns that arise, that are giving rise to the psychological stressors. And many of these psychological treatments are designed to enhance individuals' ability to implement more coping adaptive and reduce maladaptive coping. So the positive psychological reaction. So you have the benefit finding and the post-traumatic growth, okay? So in the benefit finding, it is a cognitive process in which the individuals will identify positive contributions that a diagnosis of cancer has made to their lives. It is an example of positively oriented coping strategy or approach-oriented coping strategy like we had discussed before. For example, an individual might identify that the diagnosis of cancer would lead them to consider what really matters in life. What matters? Your family, children, houses, bank accounts, you know? Subsequently, this could lead them to an increased quality of life. So that also supports the acceptance that they've got this and they need to deal with this. This is the benefit finder. What are the benefits of having the diagnosis? And what do you do therein? Accepting the fact that this has happened, I need to move on. So in a lot of research, research primarily concluded with breast cancer survivors has shown that interventions to increase identification of benefits to a highly stressful experience like cancer can improve the quality of life, okay? For the post-traumatic growth is significant to cancer diagnosis due to the potentially life-threatening nature of the diagnosis. Individuals may be forced to consider their own mortality and may add by altering the way they relate to others, the world, and even themselves. Cancer presents individuals with a major health threat that often challenges one's own self, and they may attempt to have the changes to their lives as a result of the diagnosis and the treatment, meaning making is the effort to restore order and purpose to people's lives that have changed drastically due to the disease. Also, it could be a part of a positive growth process as well that occurs after the diagnosis with cancer and associated with greater quality of life and well-being. Then we also have the behavioral. How do these patients, how do they cope? You know, how do they present to the world, to the people, to their family? And so it's also saying that for the behavioral coping responses, it addresses the behaviors associated with the risk of developing cancer and the behaviors in place for individuals that are at risk at poor disease outcomes. So it is part of a preventive medicine behavior, such as giving up smoking if you've got cancer, and the use of skin protection, as well as the adherence to treatment regime. So it's a whole multitude of things. It's very individualized. What coping mechanisms do you use to manage the outcome of the disease? So it's either positive, or it could be your behavior change. But in each of these steps, they need support, and they cannot do it alone. They cannot do it alone at all. And that's where, remember the term cycle, you remember? So we are dealing with not just the mental health, we're dealing with the psychology of the person, the physiology of the person. We're dealing with different other fields, because it's not just the cancer. It could be the mental health. It could
Right.
be the mental health. How do we deal with the mental health of these patients?
Yeah.
How do we make them have a change or begin to accept the fact that this has happened, but we need to manage it stage by stage? And it is a collective effort.
Right. I never knew that there could be so many factors just in this phase of treatment a patient can go through. I knew that there are issues about acceptance and then the grief they go through, but this is such an important thing which you can listen only from a psychiatrist, a professional, that there are patients who accept this and there are some positive outcomes. They just
Mhm.
adapt some good healthy changes in their lives. And
Yep,
if these examples are given to a patient by a psychiatrist, uh, it could really bring up some really good change and early acceptance and trying to work on the current problem. So
yep,
I think this is really important that first of all accepting it. If the patient is not accepting, the family needs to recognize what the patient is going through and avail the help of a psychiatrist, where the
yep.
patient can be taken in good hands, understood the emotions, and given all these examples. So, it's a human tendency that if you are given multiple examples, then you tend to correlate and you tend to accept and move on. So, it is really important to involve a professional at a right time. That's very
Exactly.
important.
And it is not just the job of the psychiatrist, it's also the job of the loved ones. It is the job of the
Absolutely.
psychologist, because at this point, a lot of psychological interventions come into play. So, and sometimes you'll be surprised that sometimes as well, the patient probably anticipates that something was wrong
Yeah.
when they get symptoms. They anticipate that this could be the big C, but then the problem for them would be, how do they break that news to their loved ones, their families, their husbands, their children? So sometimes you find even in families, it's not the patient themselves that don't have the understanding, it is the family members. It is the husband who is not accepting, oh my God, my wife has cancer. How do I deal with it?
Yeah.
So family therapy comes into play here. A lot of families are unable to accept this is happening and they have to make a change. They need to think about the future. They need to think about the plan. And
Mhm.
so, it is just so heartbreaking and very, very difficult. And
Right.
yeah, so behavioral modification is also relevant to improve quality of life to those who are living with cancer. Adherence to medical treatment is, of course, crucial in managing cancer, a topic that largely falls under the purview of psycho-oncology for
Mhm.
the behavioral causes for lack of treatment adherences. A number of factors can contribute to lack of treatment adherence, including the toxic side effects of the medication, misinformation or lack of understanding of the treatment regime, the lack of communication between the patient and the doctor, with the medical providers as well, lack of treatment support, lack of medical support. For example, treatment self-management. We have a lot of people who do a self-management at home rather than going to the doctor and present late. In addition to the psychological factors like depression and anxiety, which is seen in patients who have cancer. Treatment adherence has become an increasingly important topic of study in psycho-oncology due to the advent and proliferation of oral anti-neoplastics.
Mhm.
Individuals on oral chemotherapy must manage sometimes complex treatment regimes at home
Right.
on their own and
Mm.
be able to communicate effectively with treatment providers to manage toxic side effects that may influence their ability or the willingness to
Mhm.
take the prescribed medication without the assistance of nursing, as in traditional IV chemotherapy.
Mhm.
Then you also have the social support and isolation, which is another very big problem.
Mhm.
During a stressful experience, such as cancer diagnosis, social connections can be broken. A lot
Right.
of people become isolated because they don't want their friends or their extended family members to know that they've been given this diagnosis. They don't want their friends to know that they have cancer. So they decide to remain alone and isolated. And it is worse for people in this country, especially, who have no family, no connections.
Mm-hmm.
And, you know, we're in a world where we walk, walk, walk. You don't even reach out to people. And
Yeah.
you're dying at home, alone, afraid, anxious, depressed. So
Mm-hmm.
these are some of the stigmas we need to break. People need to speak out so that they can get the adequate support. We have 24 hours helplines that are not being used by a lot of cancer patients just to talk, a time to talk.
That's true. It's
And so
only, I think,
coming to the mental side of things, you find a lot of people who come in through the cancer units to our own units with suicidal ideations. Self-harm is on the increase, depression, anxiety, agoraphobias, generalized anxiety disorders. You know, the list goes on and on.
that's
What
true.
do you treat? So
Yeah.
the research in the broader field of the health psychology has revealed significant influence of social support on the psychological well-being of these individuals, as well as the associations between the disease processes, particularly in cardiovascular diseases. Patients undergoing treatment for cancer often rely on a social support network of varying sizes, including their spouses, their
Mm-hmm.
children, their
Mm-hmm.
friends, and other family members to support them through these difficult times. And the functional impairment. These types of social support refers are instrumental in, related to tax-based support. Additionally, the emotional toil that cancer diagnosis can take on a person necessitates a degree of emotional support from the support network. This is where everyone comes into play. So both instrumental and emotional support network have shown in research to improve the quality of life of patients being treated for cancer.
Right.
Conversely, a diagnosis of cancer can be significantly socially isolating for
Mm-hmm.
individuals. So life changes, including functional impairments, may separate people from their family and friends, and a shift from healthy to ill in
Right.
terms of self-identification, which may lead to a sense of social isolation as well. And the
Mm.
research has shown that social isolation and the perception of loneliness has significant negative impact on the physical and the psychological quality of life in individuals with cancer.
That's true. That's true.
And so communication, so you see, we're taking it step by step.
Mm-hmm.
So communication now comes into play. The
Right.
communication is so important. The communication with your friends, communication with your social network, communication with your medical providers has been identified as an important social factor throughout the cancer trajectory.
Right.
Communication has been shown as well to be associated with improved medication adherence and satisfaction with care.
Absolutely. Such a
It's a,
such
it's a,
a
it's a, it's
such
a
a good
long
piece of
haul.
information. Yes, and
It's a
I
long
think,
haul.
as you correctly said, that this particular group of population and the psychological support to them is a very
Yes,
special topic in itself.
yes,
And
it is.
we spoke about what should be done at the time of diagnosis and when the bad news is actually being broken up,
Broken.
and
Yes.
during the treatment what can happen and what are the various aspects during that. And the very important part now, once they are diagnosed, I want to ask what should be, how the families can be supported. Sometimes the family cannot understand that whether they should show sympathy, and if the sympathy is going to just keep reminding them of what has happened, or they should completely show that nothing has happened and everything is just fine. So the family is always in a dilemma, how to react around them and how to behave around them. So is there any particular advice you will give them? And as you mentioned that there is a terminology called family therapy, and does this help, does this kind of therapy helps such questions coming from the family side?
You've asked a very, very good question. I'm sure we've also talked about it on the various support these patients can get. In terms of family, yes, family therapy plays a very big role, and
Right.
the psychologists and the mindfulness practitioners actually have their work cut out for them.
Okay.
The family is the primary unit that the focus should lie with,
Right.
including the patients themselves. You
Mm-hmm.
know, there are various strategies incorporated in managing, like we said, the diagnosis, and how do the families together come as a support network for this patient.
Mm-hmm.
Um, it's quite difficult, you know, putting myself in their shoes. I don't even know um, how it can be managed effectively.
Mm-hmm.
There are various therapies that have been pondered and considered, and you know, research has shown that they work. For example, you have the CBTs, the ACT, and other effective interventions for this patient. Apart
Mm-hmm.
from the family therapy, which should be ongoing throughout
Mm-hmm.
the treatment model of, you know, of that individualized patient person.
Mm-hmm.
Psychological interventions are so that they're primary, very much primary, to keep this patient functioning
Mm-hmm.
and to make sure their mental health is protected as well. I'll
Right.
take you through a few of the modalities I've written up here so
Mm-hmm.
that you'll understand. So we've said, hold on, let me just get this. So we have a lot of multiple evidence-based treatments for the mood and anxiety disorders that might come up, you know, with the diagnosis of cancer.
Mm-hmm.
And dealing with these stressors directly could actually trigger these individuals. So the common maladaptive cognitions that are associated with cancer would include misinterpreting pain or other physical sensations as cancer progression starts,
Mm-hmm.
or they're struggling with the uncertainty of the treatment and life thereafter. So
Mm-hmm.
you have the cognitive behavioral therapy modality, which is one of the psychotherapies particularly well suited to manage these cognitive concerns that the patients have that emerge as the cancer progresses. And it serves to interfere with the individual's quality of life. So the CBT and adjacent therapies have also been used to support the management of chronic pain and the fatigue that the patient treatment with chemotherapy often experience, helping to improve both their interpretations of the symptoms, but also help manage their lives behaviorally in the context of the um, functional impairment. So it also helps to improve self-regulation, especially with people with breast cancer and colon cancer, the CBT. Then you have the mindfulness. I'm sure you've heard of mindfulness, which is
Mm-hmm.
one of the key in psychological intervention, used a whole lot, both in I think in all fields of medicine, even outside right now. So mindfulness is an area of interest, as it's a common element across multiple modalities of mental health treatment now. And it has shown effectiveness in ameliorating depressive symptoms and anxiety. Mindfulness-based stress reduction, specifically intended to help patients with cancer, have proven effective in decreasing levels of cancer-related distress. More recently, digitally delivered
Mm-hmm.
psychotherapy is being investigated as a low-cost, highly accessible treatment method. So right now you have apps on your phones,
Mm-hmm.
on your Android phones. You have apps for mindfulness where patients can download this app and follow the instructions. It could be as simple as breathing exercises and breathing techniques and taking yourself away from that environment and just, you know, breathing and distressing. It helps a whole lot. Then you have also what we call the routine distress screening as awareness of prevalence of psychological distress that accompanies um, the cancer diagnosis, increase efforts to integrate evidence-based psychosocial treatments as well as oncologic care
Right.
Screening for adjustment to diagnose and treatment becomes very, very important.
Right.
Routine distress screening throughout the cancer process, which is the diagnosis, treatment, and survivorship, is crucial
Hmm.
in identifying patients who are already struggling with symptoms.
Right.
Okay?
Yeah.
I'm sorry.
It's really, let's please take your time. It's really good to know that there are some apps supporting to improve the mental health, as you said,
Yeah.
improve the mindfulness. And it's really good to know at the same time that we are thinking about patients' mental health, but also the
Mm-hmm.
family's mental health, because
Yeah.
family is the backbone, and they do support the patient throughout the process of being treated, diagnosis, and literally everything. So it's very important for the family to be mentally fit to support the patient on his toes to get treated and get better. Thank you
Exactly.
very much for talking about the term family therapy, and it's very important to know. I think it's important to admit for the patient as well as the family that the situation is difficult and they need help. And we all know that there is help available for treatment of the patient and taking care of the patient physically, but to know that there is mental health professionals available to support the family as well as the patient, and this
Yeah.
aspect is very important to be aware of.
Yeah.
And now I have one last question, and that is, I think it could be really important and for everyone to know that once the patient is diagnosed and cured and now is going back in the society, going back to work, do they need mental support at that stage? Because they are really afraid. Some people do not like the sympathy. They want to be treated just normal as if nothing has happened. Or some people are just worried that how they are going to be perceived. So these are a couple of things I think they may be going through their mind. So have you come across anything like this, or what do you think what they may go through and what can be done for that phase, a post
Um,
treatment?
well, that's another very good question. So it's just to let everyone that there is help available at every stage of your treatment, post-treatment as well. You have helplines available, the Samaritans, Time to Talk. There are lots of psychological tools available through the NHS as well. There are lots of private psychotherapists for those who can afford it. There are lots of apps online that are very, very cheap, low cost, accessible, and available, and helpline 24/7.
Right.
You also have the Marie Curie nurses who are there, for those who need post-discharge care.
Mhm.
So you have so much available in this country via the NHS, via privates, via online. That's, you have the total support you need. It's just reaching out and it's to speak. And in terms of mental health, we have care coordinators who are available. We have crisis helplines. We have teams. If you're in crisis, please reach out, please call. You can go through your GP as well, who can arrange that for you. And, you can come into hospital for a few days of respite where needed. And I know as well that some NHS trusts have post-cancer clinics where you can visit. You can have therapy that is free to you, and
Mhm.
they engage you in other activities to make sure you're functioning as a whole being. And that goes on for months, years, depending on how much of it you need. So the assessment and the treatment and the care is available to everyone 24 hours a day. Please reach out. We are here for you. We are here to support you. And good luck. Yes.
That's a perfect piece of information, Gloria. I mean, I think the most important things you mentioned are that there is help available for
There is help.
every stage, from the time of diagnosis, treatment, and after the treatment,
Yeah.
not only for
Yeah.
the patient, but also for the family of the patient. And it's
Exactly.
wonderful to know what are the different means, what technology is doing for us. There are so many apps, and NHS has so many things to help the patient around, and there are some private helps available as well. And
Exactly.
also, as
Exactly.
we are supporting Cameron Grant Memorial Trust this year, they also have a helpline where you can call and you can discuss about your issues. And I'm sure it is not only for patients who are going through depression, but also for the patients who are going through depression because of severe illnesses, and
Exactly.
their families as well. So it's really good to know that we have so much help around us, and I hope we have come up with some really good information for all of you here. And I cannot thank Gloria enough for bringing such a huge amount of information, and with such a kind heart to give us time and discuss this important topic. And
Thank you
thank
very
you so
much.
much, Gloria. It's
Thank you
really
so much, Peter.